Lateral ankle sprains are one of the most common ways athletes injure themselves. And about 40% of ankle sprains turn into a chronic ankle instability. Today, let's talk about what the research says with regards to ankle sprains, what's the most effective ways to treat them, how to prevent something chronic going on, and even ways of minimizing the chance of an ankle sprain to begin with. My name is Dr. Shine Safar. I'm an orthopedic clinical specialist in physical therapy. I'm the owner of Unity Physical Therapy and faculty at my graduate program. I'm also a professional stuntman, competitive martial artist, and breakdancer. And in my time as a professional athlete and as a clinician, I've dealt with a lot of ankle sprains. So I think going over what the literature says about ankle sprains will really help us make some more informed decisions. However, this does and should not substitute a medical exam because everyone's case is different. And for you to get the best care possible, you should see a clinician so they can take into account all those unique variables about you so you can get the results that you want. Now, let's talk about what is a sprain. A sprain is a word that basically indicates that a ligament, which is a piece of tissue that connects two bones, has been irritated. The function of a ligament is that it provides some stability by connecting those two bones together. That's going to be important because when we're talking about dealing with an ankle sprain, we now know that we might have lost a little bit of that stability. Now, there are 3 grades to an ankle sprain, with the grade 1 just indicating a mild irritation, grade 2 indicating a partial tear, but there are still some fibers of the ligament intact, and grade 3 is a full tear of the ligament. With lateral ankle sprains, the most common ligament that we're dealing with is called the anterior talofibular ligament. However, severe sprains can also hit the calcaneofibular ligament. And in some cases, if instead of rolling your ankle, you kind of planted it and twisted your foot, and your pain is a little bit higher up, you might be dealing with what we call a syndesmotic injury. Now, whenever we're dealing with an ankle sprain in the clinic, the first thing we need to assess is, hey, is this person a good candidate for physical therapy? Are they safe? And what we're worried about is a fracture. Now, luckily, there's something called the auto ankle rules, and it's a set of rules that helps us determine, does somebody need to get an x-ray, or are they safe and we can go ahead and treat them. The really cool thing about these rules is that they show a 97% specificity, meaning that they are 97% accurate at ruling out a fracture when we compare it to an x-ray. The test is really simple and quick and is a really good tool. I'm trying to see, can the patient walk 4 steps, and do they have tenderness to some spots on their ankle? The lateral malleoli, the medial malleoli, and even some spots on the foot. To be really specific, we're looking at this tenderness on the posterior tip of the last 6 centimeters of the malleoli, because when there is an injury, the anterior side is probably just going to be irritated, but for ruling out a fracture, we have to get a little bit more nuanced with that. Now, if you fail any of these, I go ahead and tell my clients that, hey, we should just stop right there. Let's go get an x-ray first to be safe. Now, remember, no test is 100% specific, so even if they fail the test, it doesn't mean that they have a fracture. It just means that we should be safe and go get it checked out. Now, most of the time in physical therapy, we deal with x-rays first before we deal with MRIs, especially with ankle sprains. If we notice that after 6 weeks, the pain is still really persisting and the radiograph is negative, that's oftentimes or sometimes an MRI is necessary, but it's all case specific. So immediately after an ankle sprain, if we determine that the person is safe and ready for rehab, this is what the American Physical Therapy's Clinical Practice Guideline states about the rehab. The Clinical Practice Guideline is usually a summary of the research to show what are the best things that we're seeing. Now, there are 3 main things that the research says is the best for that immediate phase after an ankle sprain: early weight bearing, exercise, and manual therapy. Now, early weight bearing means we want to get up on our feet and walk as soon as possible. However, there is a special note that basically says there is no evidence that special footwear or brace is better than others. It's all case specific. Basically, we want to support the ankle enough that you can walk with as little pain as possible, but not so much support that it's affecting the way you walk and limiting your motion. It really depends on how severe the sprain is. And in some really severe sprains, we want to do a period of immobilization, but what the literature is showing is we just want to do that up to 10 days, which I think is a lot less than people think. I've heard sometimes about people doing 2 to 4 weeks. The issue is that it's going to cause the swelling to stay in there, stiffen up, and even maybe atrophy some of those muscles, which can cause some more problems down the road. Long story short, we want to get moving as quickly as possible, which goes into our next one, which is exercise. Yeah, believe it or not, after an ankle sprain, we want to exercise. What that looks like, though, is maybe some protective active range of motion, some gentle stretching, especially in that weight-bearing lunge position. Maybe not so much in the toe point position, because that's kind of what we probably stretch too much when we roll our ankle, and isometrics of the ankle muscles, especially the fibulari muscles. Isometrics basically mean you're just providing a constant resistance instead of moving your ankle back and forth. Those fibulari muscles often get stretched with the ligament, and turning them on will help kind of take some of that swelling out, provide some stability to the ankle, and tighten those muscles back up. And the last thing in that immediate phase is manual therapy. That's hands-on therapy. We want to do some soft tissue work, some ankle mobilizations. It's really helpful for improving that range of motion and managing swelling. Now, there's mixed evidence for other things like acupuncture, laser, electrotherapy, stim, even ice. There's one thing that the research shows, which is an A-level recommendation against ultrasound. A-level being the highest level of recommendation. There's some research that shows pretty confidently you shouldn't be using ultrasound in this case. Instead, I like to focus my time and energy on those three things: early weight bearing, exercise, and using my hands for some manual therapy. Now, as the rehab journey progresses, we might switch from maybe less manual therapy to more intense exercises, maybe some single leg balance stuff, getting those proprioceptors back up. One of the really interesting things is when we sprain our ligaments, these things called proprioceptors, which are basically these receptors that tell you where the joint is in space. So even if you close your eyes, you would know is my hand moving up and down. These are really important for athletes because while we're, let's say, playing soccer, doing jiu-jitsu, flipping, our brain is already tasked with so many things that these proprioceptors kind of let our body know where we are in space without having to take up our visual system or our balance system. After these injuries, those proprioceptors can get damaged. However, they can come back with practice. So we want to challenge those proprioceptors. One of the things I like to do is some single leg, eyes closed training on a firm surface. The reason I like a firm surface is because it provides more feedback and that quick response to the ankle so that the ankle can learn where it is in space. The nice thing about working on proprioception is not only is it going to help boost your athletic performance, but it actually helps dampen down pain. The proprioceptive pathways to the brain are faster than the pain signals, so the more proprioception we get, oftentimes it can help minimize some pain. And as we get our mobility, our strength back, our proprioception, that's where we're going to start transitioning to more sport-specific tasks in a rehab journey. Now, how long does this take? Sometimes up to a year, and that's where we go into something called chronic ankle instability. Chronic ankle instability is where you report some instability in the ankle even after a year or a subsequent sprain. Now, earlier I said that about 40% of people develop this. For chronic ankle instability, we actually still want to use a brace while we're doing our athletic activities. However, that's not a standalone treatment. We should still be doing corrective exercises, even manual therapy, we still have some mobility limitations. There's still an A-level recommendation for exercise therapy, especially balance and postural stability. Now, people always want to know about the new hot techniques, and one thing that's really popular right now is dry needling, which in some states physical therapists can do. But with dry needling for the ankle, we have a C-level recommendation. There's some mixed evidence on its results. However, it's a pretty new technique, so I'm sure more research is going to come out, and that might change. Long story short, I think more importantly, as I mentioned before, ligaments provide stability. So when we've done some irritation or damage to that ligament, the big thing that we need is to build stability back in the ankle. And that's where exercise is really going to come in. What does the research show about preventing ankle sprains to begin with? Actually, taping and bracing prophylactically, meaning ahead of time, is shown to be helpful. Balance training is the big one, and an exercise program based on your needs and impairments. Lastly, they show that strengthening the hip abductors and extensors, those are your glute muscles, are really good too. I hope this video helped you understand a little bit more about ankle sprains, what clinicians think about, and what the journey of it looks like, and maybe even how to prevent one to begin with. If you enjoyed this video, please subscribe, follow us at UnityPTLA on social media, or go to our website, unityphysicaltherapy.com, and look out for more videos on performance, wellness, and injury recovery. Thank you guys, have a great day.